Welcome back to Great Day Houston. Actress Emma Stone was once convinced the house was burning down even when it was not. John Mayer has suffered from severe panic attacks, and despite winning a Heisman Trophy, Earl Campbell could not speak in public and would have sworn he was also having a heart attack. Mental illness can impact anybody at any time. Here to discuss anxiety and how to manage it is Dr. Cory Walker, senior psychiatrist with the Menninger Clinic. All right, anxiety, at the root of so many things. What is happening in the brain when anxiety takes over?
So when anxiety takes over, we have an increased hypervigilance. We have an increase in our warning systems. We will see our fight or flight nervous system kick up. We will see our attentional systems kick up. So we'll be distracted. We'll be looking around, trying to be very vigilant of our surroundings. The other thing that can happen, though, that's almost counterintuitive, is that we can get fixated on something. Yeah. So we'll become very worried about something that maybe initially makes sense to worry about, and then when it becomes anxiety, it goes beyond a traditional worry. Yeah. For example, maybe I'm having a birthday party for my young child, and so I decide I'm going to bake the cake. And I'm worried that I want the cake to turn out well. But when that worry becomes I'm going to the store repeatedly buying the ingredients, I want to avoid the mothers who were at the party because I'm not sure what they thought of the cake. You
become obsessive. Well, obsessive compulsive disorder is also a place where anxiety hits as well, right?
Absolutely.
All right, and then even going to, my son is dyslexic, and early on you brought out a book and he'd run to a corner and cry, and he would say, I can't do it, I can't do it. When in reality he could, and we had to practice some things like a repeated exposure, which is part of therapy, right? To put it out in front of him over and over again, and he got to see that, no, wait, I can. If I just stop and look, I can do this. So we've heard of things where people could not, phobias, for example, another place, right? Could not leave their house for some reason, the fear of leaving their house. So first of all, it has to be a no judgment zone when people come in and talk about it, because there are a lot of people out there who are like, they know that average people don't understand it. So when it comes to therapy, what does that look like?
When it comes to therapy, it depends on how far along the course you are. It could look like coming to the office and having a few sessions and learning some techniques to interrupt that train of thought and kind of doing some cognitive restructuring. Yeah. If you are at a place where you're debilitated, it could look like coming into the hospital, having people help you with your structure, help you with your daily living, help you face those challenges.
Yeah, and having to convince somebody who really feels like they're having a heart attack, and actually they're presenting like they're having a heart attack. They could be sweating, the muscle tension, all kinds of things.
Yes,
absolutely. It's real to them.
And when they come into the ER, you'll find out that they get worked up for a heart attack. They get the EKG, they get the stress test, they get the blood test looking for biomarkers of heart damage, because it's very convincing. Our brains are telling us we're dying.
Oh, wow. All right. Of course, the common reaction from people who don't understand is just calm down, think differently, or don't worry about it. Those words aren't really helping, are they?
They're not helpful at all, but it makes a lot of sense why people would say that, because when our brains get ill, it manifests as behavior, and typically when we're well, our behavior is a choice. When we're not well, our behavior is not a choice. If you were having a heart attack, I wouldn't tell you, oh, you know what, just breathe deeper and stop having that chest pressure.
Right. All right. And kids, 25% affected by anxiety disorders as well, age 13 to 18. If we don't address it, if you just look the other way, we also know that there can be a higher chance of substance abuse, coping mechanisms that aren't good for them.
Because with the substance abuse, for example, if I take a pill, I have immediate relief. I also am subject to having to meet with a doctor, convince people to give me these pills, whereas if I learn coping skills, I don't get immediate relief, but they're 100% in my control once the anxiety is managed. Sometimes anxiety must be managed with medication. However, to set the tone so you can learn those skills. However, once you have those,
the brain almost.
Exactly.
So that you can hear
but then you can plant those skills in there and they're yours.
Yeah, and the other last thing is that another important reason to address it is that oftentimes when someone feels like they're with that level of anxiety, they feel like their only way out might be suicide. Exactly. So these are things that can be stopped, it can be preventive. Someone may live with it for the rest of their life, but the key is knowing how to be in control of it.
Absolutely, and knowing when to get help, knowing that you're not alone. 19 million people are in the same boat. Mental illness is a disease of isolation, and the first treatment is social integration.
All right, Dr. Walker, thank you very much. When we come back, lifting the shame surrounding mental illness and what has made Menninger a leader in that fight.